Right now, your hands are doing exactly what you tell them to do. You're reading this. Maybe you're holding a phone or a mouse or a cup of coffee. Your hands are completely, automatically, unquestionably yours. They move when you decide to move them. They stop when you decide to stop. You have never once had to negotiate with your own hands. Now imagine waking up one morning and one of them is gone. Not physically gone, still attached, still warm, still capable of feeling everything you touch, but no longer taking orders from you, moving on its own, picking things up you didn't choose to pick up, putting them down when you wanted to hold them, unbuttoning what you just buttoned. And the most terrifying part, it doesn't feel like a spasm. It doesn't feel like a tremor. It feels purposeful. It feels like your hand has somewhere to be, something it wants to do, entirely independent of anything you've decided. This is real. It has a name. And it happens to people in ordinary life after a stroke, a brain surgery, or a slow neurological disease begins quietly dismantling the bridge between the two halves of their brain. This is the story of what it's like to live with your own hand as an adversary. Level 1, the stroke. You're 58 years old, and you're making breakfast on a Tuesday morning when the headache arrives. Not a gradual one. An instant one, severe and sudden, behind your right eye. You set down your coffee and stand very still for a moment, the way you do when something feels wrong in a way you can't name. By the time you sit down, your left arm feels heavy. Not painful, just different. Like it's not fully part of your instructions anymore. You recognize a stroke. You've seen the awareness campaigns. Face, arms, speech, time. You call the emergency services yourself, which is what saves you, because you make the call in the window where intervention can still limit the damage. At the hospital, an MRI confirms an ischemic stroke, a clot that cut off blood supply to the left medial frontal lobe and the anterior portion of the corpus callosum. The clot is treated. The immediate danger passes. But the damage left behind by those hours of interrupted blood flow will take weeks to reveal itself fully. The stroke has done something specific and strange to the geography of your brain. It has cut a cable. Level 2, the bridge. To understand what happens next, you need to understand what the corpus callosum is. Think of your brain as two separate processors running simultaneously, the left hemisphere and the right hemisphere, each controlling the opposite side of your body. The left hemisphere controls your right hand. The right hemisphere controls your left hand. In a healthy brain, these two processors are in constant communication, exchanging information through a thick bundle of roughly 200 million nerve fibers that runs between them. That bundle is the corpus callosum. The corpus callosum is how your brain coordinates. When your right hand picks up a pen, the left hemisphere sends that decision across the corpus callosum to the right hemisphere, which adjusts the left hand accordingly so they work together. When you tie a shoelace, both hemispheres are in constant conversation, sharing motor plans in real time so the two hands do what needs to be done as a coordinated team. The very first time scientists properly understood what the corpus callosum does, they found out by cutting it. In the 1960s, neurosurgeon Joseph Bogan performed what's called a corpus callosotomy on patients with severe epilepsy, severing the callosum to prevent seizures from crossing between hemispheres. It worked for the epilepsy. But the patients emerged from surgery with something nobody had quite anticipated. Their two hemispheres had become, in a meaningful sense, two independent minds sharing one body. The left hand sometimes didn't know what the right hand was doing, and occasionally actively disagreed. The surgery gave scientists their clearest window into what happens when the two processors stop talking. What happened to your corpus callosum is different in cause, but identical in effect. The stroke damaged it. The cable is down. Now your right hemisphere, which controls your left hand, is still fully operational, still capable of initiating purposeful, goal-directed movement. It still has opinions about what the left hand should be doing, but it can no longer receive input from the left hemisphere, which means it can no longer receive input from you, from your conscious intentions, your plans, your decisions. It has gone rogue. Not maliciously. It just has no way to receive your signal anymore. The left hand is now operating on its own interpretations of the world, and it is about to start acting on them. Level 3, the first time. 3 weeks after the stroke, you're sitting at the kitchen table reading the newspaper when your left hand picks up your coffee cup and moves it to the other side of the table. You didn't do that. You stare at your hand. It's resting on the table now, completely still, looking entirely normal. You reach across with your right hand and move the cup back. You watch your left hand. After about 30 seconds, it moves the cup again. Not a tremor, not a spasm. A deliberate, Smooth, coordinated movement, grip, lift, relocate, set down. Purposeful. Like someone with a specific intention performed it. That someone was not you. You call your neurologist. She is not surprised. She tells you what this is called: alien hand syndrome. She explains the corpus callosum damage. She explains that what you're experiencing, the feeling that your hand has a will of its own, is a documented neurological consequence of exactly the kind of stroke you had. She tells you you're not imagining it and you're not losing your mind. She also tells you there's no direct treatment, no surgery to reconnect the corpus callosum, no medication that restores interhemispheric communication. The management strategies are behavioral, ways of working around the hand rather than correcting it. You hang up the phone and sit with that for a long time. Level 4. The daily war. The weeks after the diagnosis are an education in how much of your daily life depends on two hands that agree with each other. Buttoning a shirt. Your right hand works the button through the hole. Your left hand follows behind it, pulling it back out. Right hand in, left hand out. You stand at the mirror for 4 minutes before you understand that you cannot button this shirt this morning without physically restraining your left hand by sitting on it. You learn to button shirts with your left arm tucked under your thigh, making tea. You fill the kettle with your right hand. Your left hand unplugs it before it boils. You stand in the kitchen watching this happen, fully aware, completely unable to override it. You tell your left hand, out loud, to stop. It does not stop. Eating. Your right hand lifts the fork toward your mouth. Your left hand intercepts it, redirects it toward the table, sets it down. You eat with your left arm held behind your back or tucked in your lap where it can't reach the table. Sleeping is the part you hadn't anticipated. You wake twice in the first week to find your left hand pressed against your face. Not grasping, not hurting, just placed there, exploring. You move it away. It comes back. You start sleeping with your left arm under the blanket, weighted down by your own body. The neurologist was right that there's no cure, but she was also right that there are strategies. You see an occupational therapist who specializes in neurological conditions. She teaches you to keep the alien hand occupied with an object, a stress ball, a weighted glove, something for it to interact with that keeps it busy while your right hand does what needs to be done. It's like giving a toddler a toy so you can have a conversation. It works, imperfectly, most of the time. Level 5. The psychology of it. 6 months in, the thing nobody warned you about isn't the practical difficulty. It's the psychological weight of living with a part of your body that you experience as separate from yourself. Your hand can feel everything: touch, temperature, texture, pain. When your left hand picks something up, you feel the object in your fingers exactly the way you would if you'd chosen to pick it up. You feel the grip. You feel the weight. What you don't feel is the decision. The sensation is there. The agency is not. This disconnect between sensation and intention is unlike anything most people ever experience, and almost impossible to describe to someone who hasn't. People ask if it's like being possessed. It isn't. There's no external force, no sense of something else inhabiting the hand. It's more like watching yourself on a screen with perfect sensory fidelity, seeing and feeling everything the person on screen touches, but having no input into what they reach for next. The psychological literature on alien hand syndrome notes that most patients, over time, do begin to relate to the affected limb as somewhat separate from their self-identity, a phenomenon that mirrors what functional MRI studies show. In people with this condition, only isolated regions of the motor cortex activate when the alien hand moves, entirely disconnected from the broad neural networks that underpin voluntary, intentional movement. The hand that moves without you isn't activating the brain areas that make movement feel like yours, which is why it doesn't feel like yours. The neuroscience and the lived experience match each other precisely. Level 6. The adaptation. 2 years after the stroke, you've rebuilt your daily life around a reality that doesn't change. Your wardrobe consists almost entirely of clothes without buttons, and you've become remarkably fast at one-handed tasks you never had to think about before. You've rearranged your kitchen so the most important things are reachable with the right hand alone. You've stopped eating at restaurants with small tables where the alien hand can reach someone else's plate, which has happened twice, once during a dinner with your daughter, once at a work lunch that you don't discuss. You've also had to tell people. Not everyone, but the people you're around regularly, because the alternative is allowing them to witness your hand doing something unexpected and trying to interpret it themselves. The interpretations people reach without context range from nervous habit to drug interaction to something they can't name but find unsettling. There was the moment at the supermarket checkout when your left hand removed items from the conveyor belt and placed them back in your basket while the cashier watched. There was the meeting at work where your left hand picked up a colleague's pen from the table and held it while he waited, visibly unsure whether to ask for it back. You found that a clear, simple explanation, my stroke damaged the part of my brain that lets the two hemispheres communicate, so my left hand sometimes acts independently, lands better than any amount of visible awkwardness. Most people, when you explain it, are genuinely fascinated. A few have pulled out their phones to Google it while you're sitting there. You've stopped minding. The alternative, the look before they understand, is worse. Level 7. The reflection. 5 years on from the Tuesday morning when the headache arrived, your alien hand is still alien. In some stroke patients, alien hand syndrome fades over months or years as the brain slowly finds alternative pathways to restore some degree of interhemispheric communication. In others, it's permanent. You appear to be in the second group. Your neurologist tells you the research is ongoing. There are scientists studying transcranial magnetic stimulation, a technique that uses magnetic fields to modulate activity in specific brain regions as a potential way to reduce the independence of the affected hemisphere's motor output. Nothing has reached clinical use yet. You follow the research in the same way you follow weather forecasts, with genuine interest and calibrated expectations. What you've learned over 5 years of living with this is something that sits at the edge of what neuroscience and philosophy share. The sense of ownership over your own body, the feeling that your hand is yours and not merely attached to you, turns out not to be a simple or automatic thing. It's constructed. Your brain actively builds the experience of being in control of your own limbs, using information from intention, sensation, and the movement itself. And when that construction fails, when the intention and the movement come apart, the experience of ownership fails with it. Most people never think about this because they've never had reason to. Their brain has been building ownership over their hands, effortlessly, every second of every day since birth. Yours stopped building it for the left hand 5 years ago on a Tuesday morning, and you have thought about almost nothing else since. And somewhere right now, someone is waking up from a stroke and noticing that one hand feels different. Not painful, just different, heavier, less theirs. They don't know what's coming yet. They're about to find out that the hand they've owned for their entire life has just developed its own opinion about what it wants to do next. It's still their hand, in every way except the one that matters most.